everybody, my name's Michelle Knighty, and for those that don't know, I am one of the co-hosts for We Are Grant County. You know, the podcast you're getting ready to listen to, and thank you so much for being here. But I wanted to let you know that before you start listening to this episode, you're going to learn all about an organization called CHNK. Now, in between the time of recording this episode and releasing the episode, CHNK has rebranded. They are now known as One Quest Health. So, as you're listening to this, just know that One Quest Health is also known as CHNK in this episode, and they are ready to provide all the services that we discuss. Thank you, and enjoy the episode.
Welcome to We Are Grant County. I'm Katie.
And I'm Michelle.
And today we're honored to speak with Hannah Burkhart of CHNK Behavioral Health, who is expanding services in our area. So we'll be talking about what's new, how our local schools are involved, how families can access care, and more. So, welcome, Hannah.
Good morning.
Good morning. Welcome to the We Are Grant County podcast.
Thank you for having me.
So thanks for sitting down with us and helping us learn a little bit more. So could you tell us a little bit about yourself and maybe like your role in CHNK Behavioral Health and maybe your background with behavioral health?
Absolutely. Yes, so my name is Hannah Burkhart. I'm a licensed clinical social worker. We actually just opened this location last August, so August 2024.
Just a year in, basically.
Yes, just a year in. And I came on as the program manager. So I currently oversee all of our programming through the Grant County Outpatient Center. I have a really long history in behavioral health. I started at the Department of Juvenile Justice. So I've been in the field close to 18 years, trying to serve our community and help those that have mental health needs.
That's excellent. And I know with a little background that's how you all met, correct, Michelle?
Yes. We met through juvenile justice.
Yes.
Yes.
So could you share, I guess, just a little bit about this organization? Because you mentioned that it was the Grant County location. So are there other locations for CHNK behavioral health that other people could visit or maybe be familiar with, since Grant County is like a new location?
Yes, absolutely. So our history goes back really far, actually, to Amos Schinkel in the 1800s, who initially established it as an orphanage. Through the years, to keep up with modern times and rebranding, we became the Children's Home of Northern Kentucky. Since then, we have continued to need to rebrand, serving adults as well. We changed our name to CHNK Behavioral Health to also be inclusive to adults and families as well. But our home location is at the DeVue location in Northern Kentucky. We have an additional location in Covington as well as Burlington. So we do offer residential services both at our DeVue campus and our Burlington campus. At our 5th Street, we offer all the therapy services that we offer here at Grant County, which we'll talk about. But it's primarily outpatient.
Okay. So what clinical and support services does your organization provide? See, there we go.
Yeah.
You segued right into that.
Yeah, perfect. So we serve a very wide variety of clientele. We offer individual and family therapy. We offer intensive outpatient programming. That's also included with 2 Grant County schools right now. So we actually do 2 outpatient service groups inside the Grant County schools at the middle school and the high school. We also do targeted case management.
Can I go back just a second? Mm-hmm. So you had mentioned where you work with 2 Grant County schools. Mm-hmm. Is it 2 school systems that you work with, or is it just 2 schools?
So we work with all of Grant County, but currently our intensive outpatient services is in Grant County Middle School and Grant County High School.
Okay.
But we service all of Grant County schools.
Okay. Because you receive referrals from school.
We do.
Yes.
We receive referrals from all the schools in the surrounding areas.
Right.
Sometimes those end up being school-based, where we meet them in the schools. Other times, we could get referrals from someone at another school that will come into the office.
Right. Okay.
Yeah.
So what is maybe like the continuum of care? So we kind of know what some of the services that you offer. So how does that look? Like, what is the long time interaction with that somebody might have with your organization?
Mm-hmm. So, for example, if we start with intensive outpatient programming, a lot of times if a client is referred, which would come from an assessment that is completed by a therapist, a comprehensive biopsychosocial, if they're determined to need the IOP services, we would recommend that. From there, we would continue to step them down in services, if that makes sense. So we would then transition them maybe to individual therapy sessions. We would maybe move them to case management for family support. We also are offering medication management so that we're kind of a one-stop shop. You can do everything here at our location. You can come in for a medication management appointment and a therapy appointment same time.
That for those of our listeners who take medication, that can be very helpful, because that just cuts your appointment times in half. Like, honestly, coordinating between different doctors and different locations. So that can be very beneficial.
And a lot of those doctors are not local.
Right.
Which makes it even more difficult for the medication management.
Absolutely.
Right.
So in the services that you offer, is anything like virtual or a telehealth or anything like that? Or is it in homes? Is it only at the office location or the schools? Like, where are the services located?
I was going to say locations, or where do you provide the services?
I was getting there.
Yeah, eventually. I know.
So we have a variety of ways. For our Grant County office in particular, of course, anyone can come in person here. But we also offer telehealth services for our group therapy sessions, for our substance use disorder intensive outpatient program. We offer that telehealth as well if there's issues with transportation. And our targeted case management, we actually go out to the homes to do visits and help get them coordinated with resources.
You had touched on like family-based services and things like that. So family therapy is available.
Yes.
So one of the questions we were kind of wondering, what specific populations or types of disorders do you all specialize in? Is there something that our listeners, maybe it pertains to them and they would benefit from your services?
Right. Well, first, I think it's important to say that, we see kids from 5 years old to adults in their 60s and 70s. So we can see throughout the lifespan, depending on when the need arises. As far as our specialties, we are a trauma-informed organization. So we address all of our services through that trauma-informed lens, meaning that a lot of the clientele that we see have had adverse childhood experiences or they've had previous trauma. And that is something that we can work with. One of the things that we see a lot of, especially now, is a lot of depression, anxiety, and self-harming behaviors in our youth in particular. We can help with that. We can help with school behavioral problems. We can help with issues or barriers to getting services, for autism or for ADHD or whatever it is. We cover a very wide range of services. And if we don't specialize in it, then we refer and get them connected to where they need to be.
That's good. So if you don't have someone that particularly serves that specific need, that's part of your services is making that connection with.
Correct.
That's excellent. Thank you.
Yes. We'll send out referrals and connect with the agencies and get them connected together.
So, Hannah, with these services that you have, what insurance providers do you accept?
So we accept Medicaid, and we accept private insurance, and that can look like Anthem, Humana, and just to kind of piggyback off that, we do have payment plans that we offer as well. So if money is a concern, that's something that we absolutely work with families on to ensure that it's not a financial burden for them to get help. So we work with them to determine a payment plan that works for them.
And that could definitely help a lot of people in this area that have more financial struggles.
Yes.
And especially in the kind of state that we're at now, finances can be very difficult or a burden for some of those services. So it's, encouraging those who, may not think that they can afford these services, knowing that there are resources that can help them.
Absolutely. And I would say one of the barriers that was noticed prior to Grant County being opened was we were getting feedback from clients that were needing the help and driving up to northern Kentucky, which ended up being a financial strain for gas purposes, transportation.
Taking off work because it takes even longer to get there. Yeah.
Yes.
Just reliable transportation to begin with, right?
Yes. So that is one of the barriers we've been able to address of that gap in care, not being able to get to the location. And even if they can get to this location, we're offering the telehealth option so that they don't have to leave the comfort of their homes. They can have access to services in their home as well.
So what is the current wait list situation? Is there a wait list for certain services?
So we do currently have a wait list for our individual and family therapy. We're looking probably at a couple months out right now, but as far as our intensive outpatient services in our schools and targeted case management and medication management, we currently do not have a wait for that. So if it is determined based on the assessment that a client should get individual or family therapy, we'll typically go ahead and get them connected with targeted case management in the meantime while they wait.
Okay.
So they're never
just
without services.
Right. Okay, that's good.
Yeah, that's been an issue for, even myself in the past, having, even going through personal crisis and feeling like there's nothing you can do because the soonest available is 2 months.
Right.
So being able to contact you all, people should still feel like they can.
Okay, Hannah, you kind of touched on a little bit about your collaborations with the schools. Are you able to help us understand how referrals originate?
Yes, absolutely. So referrals can originate from different sources. If you are a parent and wanting to refer your child, it's as simple as going to CHNK.org and clicking on, I want to make a referral. Parents can fill that out. You can fill it out for yourself. But we also get referrals from schools. So that may be from the school counselor. Teachers may recommend it, let the counselor know, and they'll submit referrals to us, and we're in close collaboration with them. So we typically get all of our referrals scheduled within 48 hours of receiving the referral, and get them scheduled with their initial intake assessment.
That's pretty quick.
Yes.
So by the time you get the referral, the parents are already on board or at least aware that that somebody's going to be reaching out to do.
Yes. For our school-based referrals, the counselors will typically get with the parent prior to doing the referral with us. They'll let the kid know, and they'll let the parent or guardian know as well. So when they hear from us, they're not surprised by that.
Okay. All right. So we've talked about a whole lot of services that you guys offer for Grant County residents. How does this get funded? What are your main funding sources that keep this organization going?
Right. So our main funding sources are grants and donations. This location in particular was funded by Bob and Carol Griffin. They were able to provide us all the funds that we need to get this up and running. So that was really huge for us.
It sounds like it. That is awesome. You had mentioned, like, sometimes when you have clients here, that sometimes you have to refer them to other places. Mm-hmm. Like, what might those other places be?
Right. So sometimes, for example, if you come in for your initial assessment and the therapist determines there's some more immediate needs, such as they're experiencing suicidal ideation, we may recommend you might want to make a trip to Sun Behavioral Health, or we may refer you to other areas of specialization.
In discussion of services, do you offer services for anyone who has autism?
So we do offer services for those that may have had a diagnosis of autism or maybe are in need of an evaluation. Those are things that we can assist with as far as doing our assessments and our therapeutic services. So we are able to coordinate with other agencies to best meet the needs of the clients. We also do referrals like for residential placements. So if for some reason we are unable to take the client in our residential, then we may recommend them to other residentials in the state if they need more intensive care.
Okay, Hannah, so we've covered a lot of things and services that you offer to Grant County residents. Is there any discussion about maybe expansion of services?
So we're always thinking about expansion because there's always a need, right? So for our location in particular, we would like to continue to expand. Since our presence here in Grant County, we have expanded, like I had mentioned earlier, to Owenton schools as well as Walton Verona schools. And we are also starting some services as far as Pendleton and Gallatin counties as well.
Okay, that's quite a reach.
Mm-hmm.
For an organization. Now, I mean, like you said, you've been around for a long time, but this location has only been around for just over a year and has already expanded into so many locations. So, I mean, that right there tells you that the need is there.
Yeah.
And the services are being...
I would say lacking before. Like, if there's been such a need, I think it's providing services that we were lacking and really discovering what those are.
But it's not necessarily, I guess, services, but you're meeting the people where they need to be met, I guess is what I was trying to get to. So the services were always needed, maybe not being met, but now it's easier for them to be met. So I think that's one of the most important things that people need to maybe take away from this is that the services are local.
Yes.
And they're here. So Hannah, we've discussed already kind of like people can be referred to your agency or organization. They can also go to the website. What are other ways that they could connect with you to see if services that you offer are what they're looking for?
Absolutely. They can always stop by our location. They can always reach out via phone. Or as you said, on our webpage, we do have contact information, so you can send email or simply submit a referral. But the first step would be to, reach out by phone or stop by our location. And we have people always here waiting to educate and guide for whatever the need is.
For those that don't know, what is the address of your location?
103 Barnes Road, Suite I, and that's Williamstown, Kentucky.
So basically your location is very central, and I mean, you're right across from the hospital, right next to the library, so that's where you guys are situated, so people can visualize the location.
When somebody's reaching out for services, do they have to reach out during business hours, or is there an emergency or crisis line?
So if someone is in a crisis or emergency situation, we would always recommend to contact 911 first. Our operating business hours are 9 to 5. But of course, if you're sending a referral or you're getting on the website and you click contact us, you can always send a message via email as well.
Awesome. As we're kind of coming to a close in this podcast, what would you want everybody in Grant County to know about CHNK Behavioral Health?
Well, first of all, that we're here and that we're here to help serve you and help you get to a better place through mental health services, through behavioral health services. And as I noted before, if there's areas of specialization that you're particularly concerned with, contact us. If it's not something we can provide, we'll get you connected with who you need to get connected with. But I think the biggest thing is knowing that you do have support here and you don't have to drive far to get it.
Awesome.
It's a great way to sum it up there.
Yeah.
Being present here is something we lacked very much. So I just wanted to say thanks to Hannah for joining us today and sharing the information about their location in Grant County here and the services that CHNK provides, and really kind of expanding the knowledge of your services to the community. So thank you very much for sharing with us today.
Thank you.
Thank you for having me.
It's been great. Thanks.
Thank you.
ToadTalkMedia.com